Let me ask you another question. There can be no discrimination against sick people. So, you have people who may decide not to get on the Affordable Care Act sign-up and wait until they get sick, therefore creating a huge pool of sick people who all of a sudden need health care. So, there is a way to milk this program, because you cannot discriminate.
Well, there again, there are some protections over the road. For one, the hospitals to this day, under present constitutional law, they can't discriminate. Someone doesn't have the insurance, they're going to have to take them. That's 30%, they say, uncompensated care. But what I like for the legislature, our legislature, to realize that this is the Affordable Care Act is a federal act, and this is our effort to try to keep as much as we can to protect our constituents here. I imagine, probably the Affordable Care Act couldn't pass in this room right now if it was a vote, but this is in the control of the Arkansas Legislature, and I just don't want it to go through our hands for our people here. So, we can talk about the federal law, and I'm not here to even defend the federal law. I'm here to try to be sure that we can do our best for the constituents. I understand your frustration.
But really, Mr. Bradford, the legislature does not have the power to put this in place.
You do. This group right here has the authority to let us put the partnership.
The partnership.
Yeah, that's what we're here for, the partnership.
Okay. No more questions, Mr. Chairman. Thank you.
Thank you, Senator, you have a question, sir?
Just a quick statement, question also, I suppose. I mean, do you realize that, I mean, we talked about federal exchanges, but Obama could not get a single vote on his budget, which contained the money to be set aside to pay for the federally run exchanges. So currently, there is not a dime to be spent by the federal government for federally run exchanges. Is that correct?
Incorrect.
Talk to me about it.
We have an interpretation from the IRS and Treasury that says there is equal money, whether it's a state or federal exchange, to operate it. So that question has come up for months since this late summer, fall, and we've had interpretation from the federal government that there is indeed money for the federal exchange.
There's enough to set up all the 25 to whatever many states that are not moving forward at this time?
Yes.
Yes.
Yes, sir.
Yes, sir. That's the answer that we've been repeating.
What's the expected cost to set up what's the federal government set aside to set up Arkansas then?
This,
to set up running exchange.
we're talking about this for this plan.
No, if they were going to run it themselves, what is their
We can't answer.
Yeah.
So we don't really know if there's enough money yet.
We have the 21 million.
I mean, the definitive answer is yes. I mean, you say yes, I mean, you know with certainty. But if we don't know how much it's going to cost in general, how can you say that there's enough money to do it?
Well,
You can't.
Right? No, I can't, because I can give you the response they gave us. That's the response they gave us.
And then here lately, and I've had some civic groups tell me, and I'm assuming this is your outreach program that you do beyond your reading, and that is on it's been portrayed that the healthcare exchange is going to be part of the saving grace for Medicaid, $400 million shortfall. And I think that the audience that was spoken to didn't really buy into that or didn't agree with your argument there. But if you could just walk me through what the argument is you're making for how we're going to add 165 to 150 to 85 million or 1,000 people to the Medicaid rolls, and yet through the healthcare exchange, how that's going to benefit our $400 million shortfall.
Well, first, I'm not sure what you're talking about. I don't know that I've been doing any outreach about Medicaid. The shortfall is right on us. Next year, it's real, and it's
I'm sorry,
before the
I've had
Affordable Care
multiple
Act.
constituents tell me that you had spoken with civic groups,
I
civic
spoke at a
meetings.
Civitan group in North Little Rock, but
Yeah.
not particularly,
You spoke about Medicaid and how this was part of the plan to solve Medicaid.
well, Medicaid enrollment, I do believe the Medicaid costs will go down right away. It's projected that the rise in Medicaid will be much lower than it's been in the last decade, half or less. We do know from studies that when people get care, and they're not on and off, but they get continuous care, their healthcare costs go down, which affects Medicaid. So my belief is that this will affect Medicaid in the short and long run. And I may have answered the question about my belief, but I'm not doing an outreach education campaign about the Medicaid shortfall.
You have any questions, sir?